Myofascial Referral Technique. Welton Myofascial Referral Technique. Whelton Myofascial Referral Technique. And thank you for joining us today. This is the Ask Dr. Tommy Show. I'm Dr. Tommy McElroy. I'm a sports and family medicine physician in Wesley Chapel, Florida, and I practice concierge medicine, all-inclusive medical care for one yearly fee. And one of the things about sports medicine, the reason I did sports medicine was because I wanted to become a more well-rounded family doctor. And so I can take care of anything from a fracture to a cold to high blood pressure to rotator cuff injuries to neck pain to back pain, and all of those things fall under auspices of what a sports and family medicine physician can do. And one of my main reasons for doing that is so I could provide complete care. Sometimes you can't, do everything. So obviously we refer patients out. We refer them to physical therapists. We refer to chiropractors, orthopedic surgeons. And I have a pleasure of having in the studio today Dr. Ryan Whelton with Sport and Spine Physical Therapy and Wellness Center. And he's going to share with some of the common things that he sees in his office and maybe some techniques and tricks that you can do and have done to you to help you become more productive so that you can go about your day and live a happy life. Ryan, how are you doing today?
Good to be here.
Ryan, how long have you been a physical therapist?
I have been practicing, 12 years now. 12 years. I'm originally from Boston, and I went to Northeastern University. I got my bachelor's, my master's, and my doctorate in physical therapy from Northeastern University. And then I moved down here about 10, 12 years ago.
You used to work in the NFL too, right?
I did. I worked for the New England Patriots. If you watch, in fact, my brother just texted me the other day and said that he saw a rerun of the Super Bowl 2003 and saw my mug on the sideline.
That's great. How long were you with the Patriots?
I was with them 2001, 2002, 2003 seasons.
Okay.
Yeah.
What was it like compared to now as far as your daily schedule and things like that?
It's wild, man. You gotta really love working in professional sports, because a lot of people don't realize it. When you see those guys on the sideline, realize that those guys are putting in 100, 120 hours a week sometimes. At Christmas, Thanksgiving, New Year's, that we all worked when we did that.
Were you married then?
No. It's tough. You can't really have a family. Well, you can, but you're on the road and you're constantly there.
So it's a young man's game who has no family yet, or at some point you basically have to be, that's your life essentially.
Yeah, it's a lifestyle.
What made you decide to leave that environment and then do what you're doing now?
Well, I can't stand the cold, so the cold is painful to me. So I always say I was born in the right family in the wrong place. So I moved to Tampa. And I started working. I worked for the VA a little bit and a couple other places, and then I decided to go out on my own, start my own business.
What is the thing that you see the most in your office? You're a physical therapist, but a lot of what you concentrate on is relief of pain. What are some of the pain types of things that people see you for?
I see a lot of back pain. I see a lot of neck pain. I see a lot of shoulder pain. I see a lot of hip pain. I see a lot of headaches. I'm a headache specialist, and I see a lot of TMJ. I'm a TMJ specialist too.
So headache specialist, everybody has headaches. What are the types of headaches that you see that related to? Is it posture? People sitting at their desk in the incorrect way? What are some of the things that you see as common headache problems?
Yeah, when you sit, you put yourself in a strained position for your neck. So instead of
describe that for them.
So instead of gravity, when you sit straight up, instead of gravity hitting you, going right through the top of your head, when you sit, your pelvis tilts back, your shoulders come forward, and then you're looking down at the ground. In order for you to see what you're looking at on your computer screen, you got to tilt your head up, and now gravity went from hitting you at the top of your head to the back of your head, and is straining your neck. So that causes cervicogenic headaches, and that's something that I have a really high success rate in treating, like 70-80%.
So when someone's sitting at their chair, describe how they should sit.
What I tell people to do, it's tough. You can't tell somebody, look, you need to sit up straight all day. And they have ergonomic chairs and everything, but those are really expensive, $400 or $500 sometimes. But what I tell people to do is to take a towel roll and put it underneath your butt bones, the back, the two bones that you sit on, your ischial tuberosities. And when you put it under the back 1/3 of those bones, then it tilts your pelvis forward and therefore takes your shoulders into a back and down position, and then takes strain off your neck, going right up the kinetic chain.
Where should your monitor be in relation to your visual field?
You can look all that. there's like an exact science to it. What I tell people is you want to look slightly down at the monitor. You don't want to have it way up or way down. But I mean, there's an exact ergonomic science to it. But as long as it's not straining you.
And this Ask Dr. Tommy show, I'm with Dr. Ryan Whelton, who's a physical therapist, and he owns Sport and Spine Physical Therapy and Wellness Center. And when we return, we're going to talk a little bit more about some of the modalities that he uses. And then he has a new technique that he's using, which is really transforming the lives of his patients, where he's able to cut down on the number of visits through a special technique that he's developed. And this Ask Dr. Tommy show, we'll be right back. So we broke it 5 minutes, which is perfect.
How was that?
Good.
Yeah?
Now I'm going to lead in with, the word. Thank you for joining us. This is Ask Dr. Tommy show, and I am in the Atlas MD studios with Ryan Welton, who is a physical therapist. And Ryan, you have this special technique that you've developed. So you do regular physical therapy and everything, but tell us about your Welton technique.
Yeah, so let's see, a couple years ago, 2.5 years ago, I was in my clinic and I made a mistake. I had one hand on somebody's back and then I touched their ankle and at the same time, and I realized I felt a sensation under my hand that was on their back. And what it was is a subtle relaxation under one point. So what I discovered is that point on the ankle connects to their back. And when you stimulate that point, if they have pain, you get an instant reduction or elimination of pain, muscle spasm decreases, range of motion increases, and people heal twice as fast as anything I've ever seen.
Is that something that's maybe similar to the way acupuncture works then?
No, this is a different system in the body. I've identified a totally different system in the body that's never been discovered before. It's not, basically I figured out how every millimeter of your body connects.
How long did it take you to put together your curriculum, let's say?
So the last couple years, I have been documenting these points and working with them. And so about two years, and I've made it so that anybody with a working knowledge of anatomy can instantly relieve pain like I do, which I think you've seen my videos. If you check out my videos.
How do people look at your videos if they want to now?
So the method, Welton Myofascial Referral technique that I invented, you can check out that website, WheltonMRT.com, Welton, WHELTON, and then there's my clinic website, which is ptandpainrelief.com, which I try to do a video once a week. I try to do a video once a week, instant pain relief.
So there's this, instant pain relief. When does it come back?
Good question. So let's say somebody has a rotator cuff impingement syndrome in their shoulder. I can relieve that pain instantaneously. But if you don't change the impingement, what it actually is pinching, the rotator cuff, then it's going to come back. So there's different diagnoses and conditions can take a little longer, but let me just tell you this. It used to take me 3 times a week for 5 weeks, a traditional PT, or 4 to 5 weeks, traditional PT to prescription to relieve pain or get somebody rehab from a rotator cuff. Now it takes me 3 visits.
So you've cut that down dramatically. And
yeah.
Then they still do the rehab exercises they need to do to improve their strength and overall flexibility, correct?
Right. Yeah. This a couple weeks ago, I was up in Central Florida teaching a couple of PTs, and they picked up on it real quick, and now have an instant pain relief just like me. In fact, they're advertising instant pain relief on their websites. And
you were telling me before the show, we were talking. You said you get a lot of flack too from people, especially on social media. It says, you're coaching the patients, and this isn't real. And what's your response now?
You can't really fake a video. So, so the thing with this method is it looks too good to be true. The fact that somebody found connections in the body that haven't been discovered before is a little bit much for some people to understand. So that's why I was like, you know what? After a while, I started telling people about this, and people were like, yeah, right. So I started doing videos. So I do a video once a week, usually once a week, with my patients of instant pain relief.
So for people out there who are skeptical and they say, well, give us the scientific reasoning behind this besides just saying this is a magic trick that I've come up with. What is your understanding of the body, and how do you explain how this works?
Right, so when I first figured it out, I was trying to figure out actually what I figured out. So I contacted Dr. Norm Shealy. I don't know if you've ever heard of Dr. Norm Shealy. He's actually kind of a legend in the medical community. He invented the TENS unit. He invented the dorsal column stimulator. He invented a technique called the rhizotomy. He's published 325 articles plus, and now he has 35 different books now, 35 different books that he's published now. What's that?
What did he say?
So I brought it out to him to ask him what exactly I was doing, or if anybody's ever discovered this before. And he said, so he had me treat his patients in his clinic. He's a retired neurosurgeon. He had me treat his patients in his clinic, and I was able to instantly relieve their pain, increase their range of motion, and heal them twice as fast. So he said, nobody's ever discovered this before.
So the people at home from a general standpoint, like how do they understand? How does this work? Is it a nerve thing? Is it energy flow, like they say with acupuncture? What do you think it is that's actually doing the relief of pain?
So the myofascial system is a system underneath our skin that connects our body kind of like a suit or a spider's web. And this is what I call I call it a myofascial meridian. It's a new type of myofascial meridian that I discovered. So I figured out how your wrist connects to your ankle and your knee connects to your shoulder. So when you stimulate a point, if you have pain in your shoulder and you stimulate a point on your knee, an exact point in an exact way that I teach in my method, then you get an instant reduction or elimination of pain.
And this is Ask Dr. Tommy Show, and we have Dr. Ryan Welton, and we're talking about his Welton myofascial release technique.
Welton myofascial referral technique.
And Whelton myofascial referral technique.
Mm-hmm.
And when we return, we'll talk a little bit more about his practice and where he sees this going in the future. Is this going to be something that's going to become widespread? And then also we'll talk a little bit more about his personal life and how he's having a growing family now. This is the Ask Dr. Tommy Show. We'll be right back.
How's that? How's that?
That's good. We're at 11 minutes, so we're actually on course to do probably 15 to 20, which is fun. So here's what I would like to cover too. So let's cover a little bit more about, some specific stories. This person had this, I did this. This person had this, I did this. This person had this, I did this. This is how you meet me. This is how you find out more about what we do. And then we'll talk about personal.
Cool.
Okay. And thank you for joining us again. This is the Ask Dr. Tommy Show, and this is I'm on the studio here with Ryan Welton. Dr. Welton is leading a kind of a new technique it's a new technique that he's using to eliminate pain in patients in a very short period of time using a myofascial meridian system. And so tell us a little bit more, some specific cases that you've done, and for patients that are out there maybe questioning whether or not this is useful for them.
Yeah, so there's a really, really powerful point for shoulder pain, or a number of points for shoulder pain on the lateral shin. So on the outside of your shin. So a lot of times I use that point when somebody has rotator cuff pain or bicipital tendonitis or even a slap tear or tear in their labrum in there. So when I stimulate that point, you see it's an instantaneous. If you're on the right point, the second you touch it, the pain will go away. If you do it the way that I train it in my method. There's another, so it increases, besides decreasing pain, it increases functionality. So there was one patient that I had, he had not been able to raise his arm up for 32 years. He had an injury to a nerve in his neck that caused a paresis or a weakness in his serratus anterior muscle, which caused his scapula to dislocate. I've never actually seen a dislocating scapula.
I saw that video.
Yeah. So he actually came in for his back. And he said, hey, do you think you can do it? I was able to help him with his back, but he said, do you think you can do anything with his shoulder? So he raised his arm up, and you could see in this video, if you check it out, it's at WeltonMRT.com. He raised his arm up, and his scapula dislocates. So what I thought in my head, okay, I need to get a point that connects to underneath that shoulder blade, the serratus anterior muscle. So when I stimulate, so I found one on the back of his calf. When I stimulated that point, first time in 32 years he raised his arm up and he didn't have a dislocation. He started crying. I almost started crying.
That's great.
Yeah.
So that's available on WeltonMRT.com. What's some other things you do? So you say you do backs too. Everybody's got everybody. A lot of people have back pain. Where do you touch on their back? That back pain. What's the point of contact on the other side?
Yeah, so in my method, every one point on the body has 30 different connections to it. So if you have pain at that one point, you have 30 different options that you can press on. But in the back, a lot of really good points that I use is the back of the knee, the back of the ankle, the back of the elbow, The thoracic spine is a really powerful area to treat.
Try this at home?
I try to teach them. It's tough because you have to have specific angles. I documented all in my manuals, but you have specific angles. When I get injured, I try to do it on myself.
Let's do a little experiment. If you're at home right now and you have lumbar pain, let's say right where the middle of your back is, let's say right above your L5, let's say. Where can they push now?
All right, so it's tough to explain it, but if you take let's say if you take your fist, okay, and rub the back of your Achilles tendon, so right above your, if we're trying to treat the lumbosacral L5S1 area where a lot of people have pain, if you rub the back of your Achilles tendon right where it inserts into the ankle, then that's a connecting point. And you got to do it for about a minute if you're doing it at home.
Much back pain, but I don't know if I felt it or if it's just my mind playing tricks on me. So that's cool. How do people get in touch with you if they want to figure out, is this right for me? They just call the clinic, go to the website, what do they do?
Yeah, so right now I'm training physical therapists, chiropractors, medical doctors, osteopaths, acupuncturists, athletic trainers, occupational therapists. You can contact me on my website, wheltonmrt.com, WHELTONMRT.com, and then also there's a contact form there. And then if you're a patient you want to get treated, it would be ptandpainrelief.com.
So if they're interested in learning, they go to Welton MRT or to watch the videos. If they're interested in actually being treated, then they go to the other website. Okay. Tell me, we were talking before there, when I first met you, you had 0 children and you were having one on the way.
Yeah.
And now tell us what's happened.
Yeah, so...
Did you feed the one time after midnight and it's like in the gremlins?
Yeah, I got 3 kids now. I got a 3.5, I got a 2-year-old, and I got a 5-month-old baby. So my wife and I aren't getting too much sleep. And in fact, I had a patient the other day say, yeah, I got 4 kids, man. Every night it's like a hostage negotiation. Like, oh, I need to go get a toy. Okay, go do it. I just don't want you to go, start screaming. So it's a good time, man.
So your youngest is 8 months?
5 months.
5 months. Is it a boy or girl?
Baby girl.
And what have you found that as you're getting, I saw a funny, actually our coordinator, Tracy Hoyle, had it, is, when you have the first kid, it's kind of like you're all so careful about it, and then by the third one, you're just like, fend for yourself.
Yeah.
You become more relaxed, I think. Is that true?
Yeah, like when their pacifiers fall on the floor, you put it, the first kid, you put it in a...
probably put it in Sidex and then you play it.
Oh, yeah, you try to decontaminate it, but then when you got 2, 3 kids, you're just trying to survive, so...
Yeah. Do they, now they're not old enough yet, but when they get older, they're going to be able to maybe start, getting teams against you and your wife. Is that something?
Yeah, I think they got one right now. Last night my son was up screaming in the middle of my 3-year-old, then my 2-year-old was screaming, and then my baby was yelling. So
so they're already trying.
They're already teaming up, man. They got something going on.
Don't let them read The Art of War by Sun
Tzu. Yeah.
Don't let them. Okay. Thanks so much for coming in. This, one of the most. The reason I had you on there because I saw your video on LinkedIn. I was like, what is this? And so I think it's interesting, and I invite everyone out there, skeptics and non-skeptics alike, to go look at it. Can't hurt to look. And then obviously contact Dr. Welton if you need help or if you'd like to learn more about it. Thanks for coming in today.
No problem. Good to be here.
And until next time, if for you out there, we invite you to listen to AskDrTommy.com. And then if you would like to have any questions, please send them in to the contact form on AskDrTommy.com. And we'll answer any questions on there, and listen to us on iTunes too. Until next time, bye-bye.
That's good, man.
Yeah, the problem with this mic is I get talking.